Thank you for having us. This is extremely out of my comfort zone, so please be indulgent. We were just saying also with Ivanka that it's very rare for us creative arts therapists to be invited in medical contexts, so it's a great pleasure for us to be here. So also thank you after this long day of conference to still be here. This will be very different from looking at the gene sequencing. For us, it's going to be a little easier, more in our comfort zone. So I will start with music therapy. Now, I don't claim to know everything about music therapy. She didn't give my graduation year, but I was certified this year and graduated last year. So I'm still very new at this profession, so I don't hold all the knowledge, but I'm here to share with you what I know, what I believe music therapy can do in a healthcare system, both in a medical and non-medical context. And as there are many disciplines of medicine, there are different approaches to any of the creative arts therapies. So a different therapist would present this in a different way. My goal is to share what it is, a little bit what it can do. And I have, if we have time, a few little clinical examples, little videos I was able to get with parental consent that they accepted for me to share here. So I want to start with a little video clip. This is classical. When people think about music therapy, that's probably what you think. Hopefully this is gonna work, and then I will, whoop. Is this not working? There we go.
Watch Music and Memory. Digital music is helping people with Alzheimer's and dementia live better lives. That is the theme of a new documentary, Alive Inside, that debuts this week.
An online preview has already gone viral as people around the world look to the healing power of music themselves.
This is Henry. He's 94, a resident of this Brooklyn nursing home for the past 10 years.
And he used to always sit on a unit in his head like this.
Henry always loved music, but dementia left him a shell of himself.
We first see Henry inert and almost unalive.
But watch what happens when he's given some of his favorite music.
And immediately he lights up and he's being animated by the music.
And even when the music stops, the transformation continues.
What does music do to you?
It gives me this feeling of love, romantic. Right now, the world needs to come into music.
He has remembered who he is through the power of music.
What's your favorite Cat Calloway song?
Oh, I'll be on the Christmas. Oh, you can come plan on me.
While the music isn't a cure for his dementia, for at least a few moments, he's Henry again.
Present, Reverend, you free out.
This is one more reminder of how sparkling the information we're learning from an appreciation of the brain.
Mm-hmm. I know this is something you covered extensively on your show too, with your brain.
Okay, how do I, this is not pertinent. Thank you. So the question is asked, is this music therapy? While it's clear that the music has an effect on Henry's brain, we don't see a therapist there. So the idea of music therapy, it's not just putting music in someone's ear. By the way, we would never put an iPod and headphones on someone for music therapy because we don't know what they're reacting to. We need to be able to interact with them. So clearly, this is a therapeutic effect of music, and we don't claim as music therapists to have the sole control over the power of music. This is available for anyone in any case. Everyone has had the experience of feeling depressed, sad, whatever, put on a good song and just feel lightened up. So as a music therapist, I see this wonderful, but I don't think this is music therapy, putting them on their ears, tending them, and just waiting to see what happens, because you don't have control and interaction with the person there. So therapeutic use of music, yes, but clinical music therapy, not quite. Okay, now disclaimer for the next slide. Many neurologists here, neuroscientists. I do have an undergrad, but I am not an expert. I do want to share a little bit of the science behind what we can observe in music therapy and what supports the interventions that we use. So first of all, it has been widely demonstrated that we are born with a brain made to process music, which I think is pretty great. It has been found that, so on the top image, specific brain structures will process different components of music. So if you pull apart music, you have pitch, harmony, rhythm, timbre, beat, emotion, recognition, all of that is processed by specific regions of the brain, and you see it's in both hemispheres. So when music is heard by your brain, there's some activation a bit everywhere. I was trying to find the MRI image I had in one of my classes, but I couldn't find it. So this is what we get for today. And then this brings us to how it connects different pathways. Different neural pathways are activated in music that are both used for musical tasks and non-musical tasks. So this brings us to neuroplasticity, which is a specific property of your brain to reorganize itself after trauma, or if a region is affected by a stroke, an accident, or something. The idea that the brain is activated on both sides by the music, you have equivalent or semi-equivalent structures on both sides. One of the easiest, or most easy, it's not easy, but examples we can use is with speech rehabilitation after a stroke, or if you have a speech pathology. We go through singing. So language is mostly processed on the left side of your brain and singing on your right side. The idea is we use a specific technique. Now, I'm not trained in this, so I'm trying to explain it. In neurologic music therapy, we use melodic intonation therapy, where we go through singing with target sentences to gradually go from a singing speech to actual singing, and we use movement to cue the coordination centers of the brain to try and recuperate the language functions. I wasn't able to find like a short clip. It's all like 30-minute sessions, so I can't show you a clip, but if you go on YouTube, you can find all kinds of evidence of that. Also, regarding on the regulation of vital functions. Now, I am not a doctor here, so I can't explain everything, but basically our brain works in all types of rhythms and physiological oscillations. And there's this phenomenon in physics called entrainment, where you can match rhythms together to sort of modulate them. So the idea, for example, with heart rate, this is widely used in specific interventions in the NICU to help regulate the heart rates. We don't use like big symphonic music because the babies will die. And they will be distressed to very terrible extents. But with very stable rhythm and lullabies, you can help because the babies are connected to the monitors. You can actually see the heart rate regulating and slowing down, which helps with oxygen saturation and all kinds of other things to help their little organs develop better if they are not as stressed. So I gave you a little bit of the science background. Now, the more historical origins, we're having a history lesson this afternoon with the ataxia, and then now with music therapy. So we all know music has been used in healing for ages, all the way from antiquity, in all kinds of different rituals, but more close to us and in more modern medicine and hospital settings. First sort of clinical observations happened after the big world wars. So World War I, World War II, in the rehab for veterans in hospitals. So during the war, they would send like actors to the battlefields or whatever to entertain and give some type of joy and beauty to the soldiers. But when they came back in the hospitals, they hired musicians to come and distract what they thought would be distracting the patients. But they realized that they had very specific emotional, psychological, physical responses, and that they were being more responsive to the standard care after the musicians, even after they had departed and they were not even in the hospital anymore. So they thought, okay, we need to hire them, but we also need to give them proper training to actually intervene in a medical setting. So by popular demand, they started creating college degrees for music therapy specifically. So that's all happening in the US. So in the 40s and 50s, and then we needed to regulate all of that. So national associations, so first in the 50s, in the US, they had two, they put them together, and then obviously Canada takes a while to catch up, so caught up afterwards, and then today it's integrated in all kinds of different health, community, social settings. I researched it to, again, show the disparity between Canada and the US. In Canada, we have 6 university degrees, both undergraduate and graduate levels, We have one in Quebec, which is good, but could be better. In the States, they have over 70, and they even go to postgraduate training. Now, to become also a music therapist, you don't just go through your university, you have to go through the certification board exam. We don't have one in Canada, so we use the American one. Hopefully, eventually, we'll get something of our own because we don't practice the same way in Canada and the US. You have to go through a specific number of internship hours, and that's like 1,200 hours or something like this. Sign the code of ethics. So there's a whole procedure. You can't just proclaim yourself a music therapist. Now, I won't read all of this, and I can't explain exactly how it is used in all of those settings, but across North America, this is more or less the kinds of settings where music therapy is being used. Now, there are different levels, like in any type of therapy, of intervention. The first two levels are more like in support or re-education, like I was talking about speech or movement or social interaction. Third level is more when you go into like deep psychotherapy. There's a whole discipline of vocal psychotherapy, which goes more into inside of the unconscious and psychodynamics. I cannot do that. You need much more advanced training, and there's all kinds of different, for example, in the NICU, you can't proclaim yourself a NICU music therapist. There's a training, which maybe I will do one day in Florida, that is very, very specific to that, and you need to do specific training. For neurologic pathologies, again, there's a specific training of that. There's 20 different standardized interventions that are very, very protocol-based that you need to learn to do. So you can't just proclaim yourself a music therapist, certified music therapist, like that. Now, once again, Canadian and American definition, Christina very kindly already presented a little bit of it. Now, they essentially say the same thing, where the music is not used as an end in itself, but as a therapeutic tool to address a variety of needs across the whole span of health and well-being. Now, again, the goal is not music. Music is the tool. We identify a series of goals, but the main goal, as we have heard over all of the conferences this weekend, is to establish the therapeutic alliance. We go through all of the interventions. We can try to address social interaction, behavioral issues with children. But I have experienced firsthand, if you don't have a relationship with the client or the person you're working with, for example, the child will literally run out on you and escape the center. It has happened to me last week. So it was our first meeting. The child was like, I don't know who you are. I don't have a relationship with you. I'm out. And over the week, I saw her again yesterday morning, and we had a whole conversation. I mean, she's 5, but she needed to understand what I wanted from her, and I hadn't thought about that. I thought, oh, kids are going to be happy playing drums or whatever. And actually, on one of the videos, the little girl is there, and she's very cute. So the goals are not musical by nature, but we use music as a medium to reach the people that we're working with. So I won't go into detail too much here, but once again, it's not just you go to the patient and you strum your guitar and you're cured. There's a whole process of how a music therapist encounters the different people that they're going to be working with. So ideally, in the ideal work environment, you get a referral. So you would be asked, so-and-so would probably benefit from music therapy because they have this need, for example, and we have heard that they like music. Being told, oh, this person likes music, you should go and see them. I don't know what else. You need to tell me a little bit more so I can prepare in advance before I go see the person. So you get a referral, and then you have an assessment, which can be 5 minutes or can be weeks. For example, with the types of kids I work with sometimes who have all sorts of complex family dynamics, you can't do that in one session. You need to understand over different weeks, because people will not usually give you their full potential the first time you see them. You're uncomfortable, they're uncomfortable, they don't know what you want. You give them an instrument, they're like, what do you want me to do with this? You need time. So the assessment is not passive. You're not just asking questions and getting answers. You're actually trying out a bunch of interventions with them, trying to see what their strengths are, what their needs are, and you try to identify what they're good at so that you can use that to target indirectly the needs that you're gonna identify. So then you have your goals and objectives, you create your intervention plan, and then you implement the treatment plan. That all of that sequence can be in one standalone session, or some people work with clients for years. So it can very much vary depending on the setting. Sometimes if you work in palliative care, you don't know if you're gonna see the person again. So you need to be able to assess the situation, target a need that you can answer and address in the time that you have, that you can measure or observe in a certain way, and be able to go through all of this in maybe 15 minutes. So the goal can be just establish eye contact, a smile, a response. That can be very, very simple, or it can be like a whole big creative demonstration. Some people, you're just very much amazed at what they can do. Then when you implement, so the treatment phase, the specific thing with music therapy, you can't just have your treatment and go and do it and just hope for the best. You're constantly evaluating, reassessing, and looking for all the nonverbal cues in the patients or the clients, however you want to call them, depending on where you're working, because you can never assume what the need of the other is, because it's ever changing. For example, I had one little boy in a group. I thought he needed like energy and to just tap on a drum and whatever, and then at the end of the session, we were going to the park, and he asked, can I keep the speaker with me and just sit by the tree and have some soft music? And I thought, why does this 5-year-old boy want to listen to like super calm music alone by the tree? Because the speaker I have vibrates on the side, so he was just holding it. And had I just said, no, we need to go play to the park, I would have completely ignored what he actually needed in that moment, to just have a moment alone, well, with me. And then he like lied down on me while the others were playing, and I was just like so touched. You can't know what the other needs. And throughout this process, even though you will target a goal, in this moment, I was fostering also the therapeutic relationship with him, where I was acknowledging what he needed in that moment. So even though you can identify a whole bunch of goals, we had in the definition all the domains: social, cognitive, speech, emotional, spiritual, all of that. If you don't have your alliance, that's no good. You're never going to go anywhere. What one of my supervisors was telling me is we all have this big idea of what therapy is, to have this big insight and have this beautiful, magical moments like you saw with Henry at the beginning. But the main goal of what we're doing is to establish a connection, a meaningful connection in the moment. You don't know what's going to happen before, after, whatever, but if there's a connection then this person will have something beautiful in that moment. Now, to go back to what Christina was asking me at the beginning, hopefully by now you will have understood what it is not. So it's not background music or entertainment. One of the things I hate the most is if I work somewhere, they're like, oh, we're having like an activity in the garden, bring your guitar. I'm like, for what exactly? To just play for people? Like, that's not what my role is. And I'm not a performer. This being in front of people is not my comfort zone. So it's not entertainment because there is an interaction. You're trying to get the other person to be creative with you. It's not a performance. Music lessons. So people don't need to know how to play instruments. Actually, it's better if they don't. Because when you have some training in music, you want to make what you're doing perfect. I have this also, you want to make it sound beautiful. You want to make it sound good. Or you're going to say, oh no, you're the professional. I took classes, but I was told I was bad. And so it's actually better when people have a clean slate, so that they're just trying to be creative. This is dead. Okay, it's back. So it's not a music lesson because the goal is not to learn how to play music. I had this graph, but I took it out because I thought it would be too long. But essentially in music therapy, we're presented it as a triangle. So you have the client, the therapist, and the music, and the relationship is between the three of us. So the music is there as sometimes, for example, with nonverbal children that I work with who have multiple disabilities, I don't know if they understand what I'm saying, but they can experience physically the music. So that can be a way in. And then if I ask them, I stop, they can say yes or no with their eyes, so I can understand what they're wanting and what they need in that moment. We also don't claim to be a replacement for standard medical or psychological care. We never claim to heal or fix the people with a magical music treatment. Sometimes you will see with dementia people, yes, they have this sort of aha moment, but we're not curing whatever condition we have. At its best, we can complement, but what we're offering people is a moment of creative expression and a moment where they can be an agent in their environment. So I personally right now don't work in a hospital setting. Well, I work in a pseudo hospital setting, but I can very much imagine, and I have obviously been taught all of these applications in music therapy in a medical context. The doctors are the best trained to address the physical and functional needs of the patients. However, as we have been told through all of the presentations, the needs of the patients are not just physical or functional. In music therapy, the very nature of the intervention addresses all the dimensions of the patient's health. We have the chance and the time to be able to sit with them, meet the person, listen to them, and give them an opportunity to have this meaningful connection through a creative medium in an environment that constantly reminds them that there's something wrong with them. They're at the hospital not because they're in a perfect condition. There's something there that needs to be addressed. And we give them a moment where they can create something that's unique to them and unique to that moment in whatever circumstance. Sometimes even the family is there, and then the family can witness whatever is happening. We give them a chance to be recognized in all of their strengths. If a patient is there, they can't move their legs, they have their arms. If they can't move their arms, maybe they can still have their voice. If they don't have their voice, they can have their eyes, they have their ears. There's always something we can use. And oftentimes also, what will happen is people will hear from the corridor, oh, I didn't know so-and-so could sing, I didn't know so-and-so could laugh that hard, I didn't know. So the staff can also get a chance to see the patients or whoever is there in a different light and get a little insight into who that person is. So we're lucky to have this unique medium. I was telling Mark Bazik in the car the other day, it's like we have a door into the person that is not me. If I can't create a relationship with the person right away, I have this other tool where I can sort of take a side route into a back door to that person and who they are. So as I was saying before, music activates the whole brain. So it's actually impossible to only target one goal. Even in a hospital setting, if we, for example, we want to alleviate their pain, they're gonna start moving to the music, they're gonna tap a beat, everything in their brain is gonna be activated, their neurotransmitters, hormones, everything is gonna be activated. And this is gonna help with all the rest of the intervention. And oftentimes, after they've had a meaningful connection with music therapists, art therapists, whoever is gonna come and see them, they're more responsive to whatever is coming next because they have had this experience of connection and they have had this trust and they have, their need for being listened to and recognized and cared for has been sort of fulfilled, and they're suddenly more open to everything else that is suggested to them. Now, as we have been told again by all the caregiver beautiful presentations, healthcare and health is not limited to hospitals. I personally don't work in a hospital per se. All of these health dimensions, people suffering, people having needs, that's everywhere, all the time, at every moment, in all different walks of life. People who are super wealthy, people who are dying of hunger in the street. By definitions, all of those aspects of health are interconnected, and social health is just as important as physical health, and they are often connected. As I will show in the next slide, in the kinds of settings where I work, most of the people, yes, have different physical pathologies of all kinds, but most of their need is for this connection, is for someone to listen to them. And once that is fulfilled, then all the rest can come afterwards. So we're addressing the person's whole identity, resilience, their ability to face adversity, creating meaningful connections. And the interventions are always active. So the person is engaging, is encouraged to be creative, have self-expression, and most important, agency, where we give them choice. Would you rather do this, do that? You have You can choose. I'm not forcing an intervention on you. Yes, I brought maybe this material, but maybe this, like I had this Chinese elder lady when I was doing my internship in long-term care. I tried Chinese traditional music to see if it would activate her, but then I learned that she was in love with Frank Sinatra. I would have never known. Or this man that was like a Scottish old man, but he loves Ginette Renault, like this super Québécois singer, which I would have never known had I not investigated and tried all kinds of different things with them. So to go to where I work. So yes, I am still a very new therapist, and because I am new, I work in very different places to sort of gain more experience and discover what I am good at and what I like. So first, the first place I work at is a very Québécois approach, pédiatrie sociale. So if you've ever heard of the Dr. Julien Foundation, this is sort of where it comes from. We work with children with very complex social situations that often result in all types of behavioral challenges, emotional regulation, like the little girl that ran out on me. And all of their development is sort of being compromised by all kinds of sources of stress, that being where the child protective services are involved, they can't see one of their parents, they have legal problems, all kinds of things. And this organization sort of targets the whole family and takes care of everyone. When they have meeting, there's the pediatrician, but there's a social worker, a special educator, the art therapist, music therapist. Everyone is there, the school is involved. So that's one place. Second place, pediatric long-term care and rehab center. It's called the Centre de Réadaptation Marie-Enfant in Montreal too. It's affiliated with the pediatric hospital, but it's a standalone place where one floor is for long-term care of very heavily handicapped children, and the other floor is for kids recovering from all kinds of surgeries. Some are traumatic accidents, and some are, for example, with the kids who would have Down syndrome. They require a whole bunch of surgeries throughout their life. So when they're recovering, they're in this place. So they have all the kinds of therapies you can imagine, but oftentimes they're not permitted the chance to just be a kid, to just be creative, be silly, have fun, create something. So on this floor with the rehab, it's a lot of that. And on the floor of the long-term care, it's a lot of soothing. They're very uncomfortable. They're in all kinds of orthesis, is that how you say it in English? Prosthesis. No, but they have to restrain their movements. What do you call that? Les orthèses, I don't know what you call that. They have corsets, all kinds of things to help them support in their wheelchairs. So they have a lot of drugs for the pain, but they're still uncomfortable for all kinds of reasons. So I'm not addressing the syndrome itself, but I'm trying to help make them more comfortable. I then have also groups of adults who are very funny. They're adults with intellectual disability, but they're all part of a choir for people with intellectual disabilities, and the choir is managed by this Jewish organization, and they wanted to offer more services for their choir participants, so they got a charity organization status to get funding, and now they offer all kinds of services to these people who are the best. And essentially we don't work again. So when they have their performance, they sing, but oftentimes they sing and they do their thing. And one of the things that's difficult for them is to actually create connections with each other and be an actual interaction. So we work on being able to listen, imitate the rhythm of the other, playing together, improvising. For example, one person is playing the xylophone and we try to follow the beat with them with a drum, for example. And then I also give example in long-term care. That was my last and longest internship. And while I was being there, I hated it because if you've ever worked in the CHSLD, you know that it's never the greatest working environment, but the patients were some of the best people that I ever worked with. I wish I had videos of them, but I didn't know at the time that I could ask for consent to have them in a secure environment for this kind of purpose. These are just a few things that I thought of recently, of things I was told. The first one was the last session we had last year with a group of adults we invited parents and friends to come if they wanted to see what we were doing. And one of the participants had a very, I don't know what it was, but a kind of syndrome where his coordination was affected, issues, he couldn't do a lot of things on his own, and he was always nervous to try all the interventions because like, I can't do this, and I was very glad to see that the whole group was like, no, you can do it, we're gonna support you, blah, blah, blah. And over the 9 sessions that we had, it was so crazy, like, no, do like me. And I was like, we're kind of overwhelming him right now. And at the end, when I asked them, what's your takeaway from music therapy? He it took a while for him to get the words out, but he said, in music therapy, I learned I don't have to be afraid to try new things. So he didn't learn, in the end, he wasn't even able to do the rhythm, but he was willing to try it. And his mom came afterwards and said, I was almost moved to tears because I've never seen my son engage for so long without disengaging, which he was doing in the first couple of sessions. The 2 other ones were a lot in long-term care where people feel like they're now not trash, but they're being put aside, like you're not useful anymore. You've done what you had to do and now you're just waiting here for your end to come. And I had this man I was working with, he was blind, had cochlear implants, so when I first came in, I was like, what am I supposed to do with music therapy here? He can't see me and he can barely hear what I'm doing. But we worked with rhythm, so he loved soul music, so he had a little adaptive CD player for blind people where he could use it himself, and I brought different types of percussion where he could improvise to the music. And I found that he was actually much better than me at any type of rhythm. And every time, obviously he forgot every time, and then I came back, and every time he was like, I didn't know my hands could do that. And he was just amazed at something he could do, and was like, I wasn't even thinking, my brain was just doing it by itself. So he couldn't hold a conversation, he never remembered who I was, but every time naturally something clicked and he was just going at it and being so happy, and the nurses would come in and be like, I thought it was you playing. I was like, no, it's Mr. So-and-so. Is this noise inside? I thought it was my heart. The last example is one of we were saying sometimes patients stay with us for a long time. This man probably passed away by now, he was so sick. But when I first went to see him, he was always in his band. Whenever someone would come close to him, he would scream, be like, you're hurting me, what are you doing? And no one was even touching him. But I realized later on he was just so scared and he didn't know what was happening to him because he was English speaking, but the facility was French speaking, and a lot of the nurses were French, and they wouldn't explain to him what they were doing in English. So he was just I don't know what's happening, so I would always go earlier than the time I was supposed to because I knew he was having his care given, and I was there to sort of say okay, they're putting on your socks now, and she just wants to clean your face, because for some reason the nurse or the PAV wasn't explaining anything, and I was infuriated every time. But as the weeks went by, it was Mr. How about next week we just go and look at the music studio? You don't have to stay there for a long time, I just want to show you what I have there, and you can tell me what looks interesting to you. And I was there for 15 weeks, 3 months, and then by the end, every time I went there, he was dressed in his chair, hair combed, and he was like, my music lady. I was like, hi, mister. But then he would just go and ask, where are we going? And I was like, okay, somehow he knew I was the music lady, but had no idea what we were going to do. And then I was like, we're going to listen to Ginette Renaud. He was like, oh, amazing. And then he would forget again, where are we going? The whole way up the elevator. And then he had the greatest singing voice. It was amazing. So sometimes the effects are measurable, sometimes they're not. I couldn't have written down what I was going to say his name, what the blind man with the drum was doing, or how this person, Mr. S, was reacting and what changed in him. I don't know, but what I can see is before and then after, and the nurses were like, now he wants to go to bingo. I was like, amazing, he can go to bingo. So I was able to get consent from, actually, 2 days ago, I called the parents, I have a strange question, could I please get some little videos of because they're kids, so there's all the confidentiality. Anyways, we're bound by confidentiality too, but the parents accepted if we didn't see the faces of the kids. So I didn't touch too much on that, but oftentimes music therapy doesn't sound like great music. In this case, it just sounds like noise because the little girls are just using percussion. But essentially, we're using, so these girls just entered kindergarten. So they're in a new environment, they need to learn to follow instruction, and all of that is going to help for them to learn to read, to write, to do all kinds of things. And if they're not used to following instruction, all of the rest will never happen or will take a lot longer. So we're working on their attention, restraining yourself from doing anything your impulse is going to make you want to do, coordination. They all have sort of motor, not deficiency, but they're late to being able to control their right and their left, follow instruction from not just me, but also their colleagues, friends. So now I wish I could fast forward the video a little bit because you're going to hear me babble, but it's in French, so hopefully no one will understand. Can we hear? Ignore the talking. So they have different. She wasn't understanding this. So the one on the left is the one that ran out the week before. Cutest child ever. So the idea is like when I point to you, you play, and when I don't, you stop. So then we exchange, try to do it together, all kinds of. So it sounds like a cacophony a little bit. And then they weren't getting it. It was fine. They were having fun. That was what I was trying to do. Just get them engaged and trying different things. So the video is a little long, so we can skip. Yes. I'm just embarrassing myself there. I allow myself to be really silly with the kids, and then when other people see it, I'm like, oh no, you shouldn't be seeing this. This is very, very different. This is a little girl in the long-term care for kids. She's entering like end-of-life care, and her mom and her dad were there, so I was able to get consent like right away, and the mom is actually holding her. And in this case, it's all about relaxation, just providing them comfort and easing. And it was like, yeah, I'm just sitting on the ground with her, and the video is actually the teacher, so this is school for her, learning to communicate and to react. And the teacher was filming for another student who can't see very far to see us on the iPad and react to whatever we were doing. Yeah. So before she was sitting on the other side, and she rolled over and she lay down she was actually on the ground. She sat up somehow, I don't know, and then she lied on her mom. And this is like 15 seconds, but we were there for half an hour. The last little video that I have, sorry, this is not me, but this is an example, hopefully this will work, of like improvisation in a dementia care context. So the idea is that the patient or the person you're working with is co-creating with you in that moment. So hopefully this will work, yeah. Once again, not music as we're used to, but quick example. This would happen all the time they would be like, oh no, I can't play the piano, I'm not able to do this. So I think I'm going a little over time right now, but just to finish, you can't dissociate the science and the art in music therapy. They're bound together. And the goal is always just the therapeutic relationship. And actually, ChatGPT gave me this quote that I didn't put here. But I was saying, what can I tell medical professionals about music therapy? And essentially it was the title of what I put on the first slide, where we're not here to replace medicine or healthcare, but we're here to enhance it and strengthen it. So I will pass it along to Monica.